Today's topic is Chapter 16 from ICD-10-CM, Perinatal Conditions. As you can see here, the codes for perinatal conditions are from P series P002 P96. You'll see conditions for neonatal stage, codes for all newborn babies, right? So yesterday we reviewed Chapter 15, the codes for the mother. Now the moment the baby is delivered, the hospital will open new medical record for the newborn baby, right? So that's where these codes should go into. All P series codes are made for newborn babies, not for mother's record. Please remember. Let us go to chapter 15, sorry, chapter 16. So here we are. This is chapter 16. Yes. We have a note. Codes from this chapter are for use on newborn records only, never on maternal records. And the codes include conditions origin that have their origin in their fetal or perinatal period before birth, the first 28 days. That's important. That is called neonatal period. First 28 days of life is called neonatal period. And we have this specialty called neonatology. And the specialist is neonatologist, right? When the baby is born, baby is examined by neonatologist or pediatrician. So you can remember P for pediatrics. That's how it is. So, and like we have seen the guideline, right? If the patient is pregnant, the first code must be from OCs. Similarly, here, if baby is under 28 days old, your first code must be from the species. Very important. You can give code from other chapters, but they're all secondary. That's important. Now let us see how these codes work. The baby is born, examined by pediatrician, and a pediatrician or neonatologist start writing notes, right? How the notes look like. So full term normal delivery. So newborn male baby or female baby, full term normal delivery, and gestational age um, 38 weeks. Then what is important is birth weight. For example, here 3,000 grams, and so diagnosis is normal newborn. This is the diagnosis. So here the baby is normal, absolutely normal. There is no abnormality. Baby is not sick. Healthy. This is a brief note. Now, the first admission, you'll get your code from ZCs, Z38. This is the first code, Z38. Because baby is normal, right? Baby is not sick. If the baby is sick, you'll get a code from P series. So here we are not going to use. And the good thing about Z38 is whether the baby is sick or normal, your first code is always Z38. Can you please go to Z38 in chapter 21? Z38 indicates whether the baby is from normal delivery or cesarean, and also um, the baby is a single or twins or multiple births. That is the information you get from Z38. Just observe this Z38 for a while, you'll see the difference. So Z38.00, single live-born infant delivered vaginally. Z38.01, single live-born infant delivered by cesarean. And if you go forward, we have the similar codes for twins, triplets, quadruplets. So Z38 series always primary code. It must be given only one time, first admission. That's important. Any questions about Z38? So Z37, Z38 look similar. Sometimes in a new coders, what they do, they apply Z38 codes on the mother's record and Z37 codes on the baby's record. It should not be done. So in this case, this is full term normal delivery, right? Normal delivery means SVD, spontaneous vaginal delivery. That is your code is Z38.00. So this is your very good. Now, for example, if the baby is sick, neonatal seizures, baby has fits, for example, you have to give additional code for this condition, secondary condition. Can you please try code for neonatal seizures? Neonatal indicates baby is newborn less than 28 days. Seizures is fits. Okay. So for this, you can go to your main term is seizures. So here is your main term seizures.
P90.
Yes. Under this, you have to look for newborn. So P90 is okay. You see, the code is from P series. P90. So for every condition, we have code for now. Your first code is Z38.00 followed by P90. If the baby has any other condition, yes, you can add. Keep on adding third, fourth code. That's how it works.
So Z category will be the first code.
Yes, first code only one time. First admission. For example, the baby will be in the hospital for 2 days, right? 1 or 2 days. Baby is normal, gets discharged, and comes for checkup after 3 or 4 days. At the time, you should not give this code. On follow visits, we should never give this code. Only first admission. When the birth happens, that's the only episode you have to give this C38.
Sir, like here, there are three permutation combinations. Like if the first 2 days when the baby is in the hospital, if this kind of special need is required, then also it will be like Z38.
Always, always. That's a rule.
And for the neonatal cases also.
Yes, because this code indicates C38 indicates the type of birth, and that must be given as per the rules. Yes, second code for any sickness.
And if the baby comes after 28 days with some special needs, like special treatment is needed, will
Yes,
the P9 will be changed in that case?
absolutely. After 28 days, you're not going to use this P series codes.
Okay.
Your watch for the baby's age, 28 days. After 28 days, the baby is coming for visit. No, you should not use these codes. If it is a fresh
Sir,
problem,
I'm sorry. There is a scenario. It actually happens with my own baby. That my baby delivered completely normal, but um, second day they checked the blood sugar level and it was quite low. So In that case also it will be, so these 38 is just for the how the baby is actually born. That's the case.
Yes, always
And if
first.
the second day he got the blood sugar level low, so it changes or no?
No, it will not change. So the first code, the baby gets discharged, the medical record is complete. Your first code is always E38.00, and hypoglycemia, low blood sugar. We have to add another code here, third code. I mean second or third code, whatever. Yes.
Okay.
So this is the only very important rule that we need to remember. This is the date. Days. But there is additional rule. For example, a condition developed during these first 28 days, and it is not resolving. It is ongoing beyond 28 days. Beyond 28 days, yes, you can use these codes in later stage also, later age also. But very rarely you'll come across that situation because most of the conditions, that if they develop in the first 28 days, they'll get resolved unless it is a congenital normal. So we never get a chance to use these P series codes at later stage. All right.
So,
So let us
sir,
examine. Mhm.
after 28 days, like we will not go with the P series.
Yes, P series. We should not go with P series. For example, baby is 30 days old, baby, and baby developed neonatal seizures for the first time. We should not use this P90, the seizures code. So this code R56.9, we have to use this.
So in the case of baby, you are saying that age really matters the first few days.
Yes, absolutely. Coder should always watch the baby's age, newborn baby's age. The cutoff period is 28 days to use these codes, P series codes. All right. So let us take another example. Now, in this case, the baby is, gestational age is normal, right? Full term, 38 weeks, and birth weight is also normal. But sometimes we see babies who are born preterm, maybe 28 weeks, 30 weeks, less than 37 weeks. Less than 37 weeks, that is called preterm, premature babies, where we see the weight of the baby is low. What is normal weight? 2500 grams. Anything less than 2500 grams is considered as low birth weight. So let us examine another case. This is baby 2. Full term norm. This is not full term normal delivery. This is preterm. Preterm normal delivery, but gestational age is let us say 30 weeks, and this is 2000 grams. The baby will be definitely in the incubator in an ACU. The first code is always Z38.00 because it is normal delivery. Vaginal delivery, born in the hospital. But um, now, what is the problem with the patient? Baby, the preterm. Now you have to go to your main term is preterm. We have course for preterm babies. Can you try? Your main term is preterm. This is here preterm. Preterm, we are talking about newborn. Preterm newborn, gestational age, so from 28 weeks onwards up to 37, 36 weeks. So 30 weeks is E07.33. E07.33. So low birth weight, right? 2000 grams. So how to find code for low birth weight? Now your main term is low birth weight, LOW. So you can try experiment with the different main terms. Uh, but actually, the best way to read a couple of pages in the index every day. The main terms. This is low, LOW. So here low birth weight. So 2000 grams, right? From 2000 to 2499, P07.18. Even babies with 500 grams, we have extreme low birth weight codes. But in this case, we'll take this code P07.18. So these are complete code because I don't find tick mark here. These are complete codes. I'm not going to the tabular list to save the time, but you have to go. You have to, every time you have to verify. P07.33 in the tabular 18. Yes. So this is the code set that you assign. Any questions? So these are the things, a few things you'll observe immediately after birth, but anytime after birth, so baby may develop complications related to any system, any organ system, starting from skin to musculoskeletal or related to respiratory, cardiology. We have codes classified according to the organ system. So these are the blocks you see here. Um, P35 to P30 infections, P50 hemorrhage. This is endocrine metabolic digestive problems, P76. Skin integumentary is P80. So this is classified based on the specialty organ system. So you want to try code for any other example? Whatever the condition you see in the um, adults, you see the same similar conditions in babies also, but the codes are coming from P6. That's the difference. So yeah,
Sir, what is difference between prenatal and neonatal?
perinatal. If you are
Sorry,
referring to perinatal, so perinatal basically it starts from the fetal age to up to 28 days. But neonatal, it refers to from birth to 28 days.
okay, so the neonatal is the part of perinatal, right?
Yes.
Okay. Oh, okay.
So these are the important conditions. So we have questions, practice questions related to newborn babies. If you remember these guidelines, yes, you'll be able to successfully code all the conditions. The other common conditions during perinatal period is respiratory distress. Some babies are born with respiratory distress, like their respiratory rate is beyond normal, 22. The normal respiratory rate is 22, right? 22 per minute. Some babies born with respiratory rate is very high, 40, 50. Of course, in the newborns, respiratory rate is very high, but beyond that, or oxygen saturation is less, we have codes for the seizures, all these conditions. All right, so I'm posting the anatomy part in the group or WhatsApp group. A very simple one pager, 1 or 2 pager document. Because studying medicine is a bit cumbersome. Like if you open any book, you will find hundreds of pages, tens of pages. That's the reason I just created one or two page a document. What is important? How to study the respiratory system, how to study reproductive system, how to study nervous system. I hope by this time you understood the sequence with which you have to study the medicine. You should first start with the anatomy, the structures, organs, the functions, then symptoms, diseases, investigations, and treatment, including surgeries. So from there also you can start practicing your coding. The conditions, the symptoms, conditions listed in the document, yes, you can find codes. So I'll keep sending for remaining organ systems. All right. So this is about chapter 16. Let us take some questions for chapter 15. Other day, yesterday, you were asking a question, right? Chapter 15, for example, postpartum depression. So we got in the index, we got F series code from
F.
chapter 5, mental disorders. But what we were talking about, the first primary code, it should be coming from O series. Any idea which O series code you take before F series?
O80.
Postpartum. OAT is normal delivery, right? OAT is normal. So you can take, because there is no specific entry for depression in the index. So what we can do, you can take a generic one, like that is mental disorders. So that's how we go. If you don't find specific one, particular one, you go for the general. Now here, if you look at here, pregnancy complicated by mental disorders. 099.34. Now this is your first code. If the patient is within 6 weeks after delivery, that is important. Or 99. Other mental disorders, complicated pregnancy, childbirth, puerperium, and we have this is a classification. So in this case, delivery happened 2 weeks back. Now the patient is with postpartum depression, which is a complete code. So the patient is in postpartum period. Yes, 099.345. Other mental disorders complicating the puerperium. Puerperium is postpartum period. This is the first code, followed by the F series code. F50, I think we got 50 code, right? That's good. Then there was another question yesterday. Um, Sequela of CVA. The patient is with dysphasia, right? The patient is with dysphasia due to old CVA. The patient had stroke, brain stroke in the past. Now the patient is out of the hospital, managing himself or herself at home, but the patient has dysphasia. That's the condition. So this is what do you call this condition? This is a sequela, right? This is a late effect, after effect, or sequela. Now your main term is sequela in the index. Sequela of. So we have a sequela of many other diseases, not just even for COVID-19 sequela. Also we have it. Likewise, disease cerebrovascular. So dysphasia, I69.92. This is how you find.
Sir, I have a question related to yesterday class.
Okay.
So there is a condition like for the C-section, we assign the code from O82.
Okay.
So this is O82 is without indication. That means there is no medical reason for C-section. It is just like a pre-planned delivery.
Correct. Yes.
Let's say like the patient went for a normal delivery but ended up with the C-section.
Mm-hmm.
In that case, also we'll assign the code from O82 only, or then it will be because O82 clearly mentioned without indication. That means no medical reason.
Right. Yeah.
Uh,
So
but
whenever
in
any such, yeah, please go
yeah,
ahead.
yeah, this is the question.
Yeah, whenever there any surgery is done, there must be indication, medical reason. Without medical reason, the medical professional should not carry out any procedure. So there must be indication. But at times, some procedures they do it for certain reasons, like it could be cosmetic reason or it could be something. In this case, for example, sometimes patients they opt for cesarean. But there are reasons. So in this case, yes, like you said, O82 is the one code. But in case like the second example, what you mentioned, patient admitted for expecting normal delivery, but ended up in cesarean. There must be a reason for this. So indication, the obstetrician will definitely write indication. Indication can be there are so many reasons, medical reasons. For example, delayed labor. They're expecting they give oxytocin, the injection, they start saline, they, this oxytocin, but they expect spontaneous delivery is not happening, causing distress to both mother as well as fetus. That is an indication. In this case, for example, fetal distress, because from time to time they check fetal heart rate in the labor room. So they check fetal heart rate. It has to be optimum. If it is increasing or decreasing, that indicates fetal distress. That's when they waited for a good amount of time for normal delivery to happen, but now they take a decision. Any delay will cause further fetal distress. So in this case, they now they go ahead with C-section. Now you are not supposed to assign O82. In this case, the fetal distress is the code, O series code, your primary code. Now how we do? We have codes for everything. So for example, I can get the code for fetal distress, pregnancy complicated by fetal distress in different ways. You want to try the code for pregnancy complicated by fetal distress? This is the indication. Complicated by, so if you see here, fetal, for example, in case a decreased movement, the baby is not moving, and if it is examined by pediatrician, sorry, the obstetrician, they will take action. In this case, O36.81. That's your code. That's the indication for cesarean delivery. depressed heart rate tones. So this is if the heart rate is decreasing. So these are the indications. These are the indications. Similarly, you'll find pregnancy complicated by fetal distress. Yes, you can set that. Yes,
So if it is a planned C-section, the code will start from O82. But if the C-section is caused by some kind of complication, so we have to find the code as per the complication of that.
yes, yes.
Okay.
If there is indication, we should not use O82.
Okay, thank
And of course, you have to give the second code, outcome of delivery, Z37. All right. So next to chapter 16 is chapter 17. What is chapter 17?
Sir, I have some doubt in chapter 9.
Okay, okay, yeah, yes.
Sir, question number 17.
1 7, right?
Yes, alcohol dependence with alcoholic cardiomyopathy.
Yes. So here the patient has two conditions. One is alcohol dependence, another one is alcoholic cardiomyopathy.
Yeah, I got the code for the alcoholic cardiomyopathy, but not the alcohol dependence.
Okay, this is alcohol dependence. Now, what's the main term? Main term is
Dependence.
dependence. So, what is dependence? Dependence means without consuming alcohol, the patient is not able to carry out even activities, routine daily activities. That is dependence. So, we'll go to the main term dependence. Because as far as alcohol is concerned, we have three types of codes: alcohol use, alcohol abuse, and alcohol dependence. So, dependence, alcohol. So, F10.20. And because of dependence, if the patient has any symptoms or conditions, then you have a very specific code. Because of dependence, if the patient has, for example, anxiety disorder, F10.280, mood disorder, F10.24. These are specific codes, but the question, yes, we can stop it here.
Okay.
So abstracting, you have to look at the number of problems. Whenever you see a patient's record, you have to see what is the number of problems. Now 1, 2, 3, 4. That is abstract. Once you list out the problems, then you have to start finding codes. Yes.
But sir, F series, I mean that code will go, I mean secondary, right? Because here alcoholic
Yes.
cardiomyopathy is primary
Yes.
one, no?
Yes. If it is a cardiology clinic and the focus is on cardiomyopathy, then your primary code is I
Okay.
series.
Okay, thank you now. Okay.
Yes.
And then
Mhm.
your question number 7.
From the same chapter
Yeah.
9.
Yeah.
Fine.
Thrombosis of left vertebral artery with infection.
10th one, yesterday we discussed, right? Left vertebral artery stenosis and occlusion.
Yeah, no, 7. Actually,
Okay.
7, sir, I got like I63.012.
Hmm.
I don't know, right or wrong.
Yes, that's correct. Thrombosis of left vertebral artery.
No, I got I63.21.
Okay. Let us see.
Yeah,
And the
thank
good thing is you're very close to you're within
you.
the category I-63.
Mhm.
Now thrombosis. Here the patient has two conditions. What are those two conditions?
Uh, First one is like thrombosis, and then the infection.
Yes. So you have to cover with the help of your code to cover both the things. If one code is not able to cover, you have to use two codes, three codes, multiple codes. That's the process. Let us go with the thrombosis first. Thrombosis. Here we are thrombosis. It started here, right? Thrombosis. Where is the thrombosis? Artery,
Yeah,
right?
vertebral artery. Yep.
Vertebral artery. So under artery, you have to look for vertebral. So here we are vertebral. Now again,
Yeah.
there is a instruction C occlusion. So again, we have to go to occlusion now because there is no code here. Now occlusion, you have to note down the path.
Yeah.
Otherwise, by the time you come here, occlusion, you'll forget. What is the path? Occlusion,
Yeah. Artery.
occlusion artery. So here is occlusion artery, vertebral, right? I think yesterday we got similar code. This is vertebral. Then with infarction,
Yeah.
I60.21. There is a tick mark, it is incomplete.
Mm-hmm.
Due to embolism thrombosis. Due to thrombosis, right?
Yes.
I63.01. So this is the final code because embolism
But
thrombosis are both different. Yes.
Mhm. Yeah, but it shows the left vertebral.
Yes. Now this is incomplete code. You have to go to I63.01. Please make a note of this code I63.01. I63.01. Now right or left?
Left, so
Left. Then 01, left is this one I60.01.
thank you. I went through the same path, but at the end, I guess I did something.
Yeah. So
Okay.
in the index you find due to thrombosis embolism, right?
Mhm.
So here thrombosis embolism. What is the difference? Thrombosis is blood clot. Embolism is circulating. It could be blood clot or foreign material, foreign body. It could be anything. It must be. It is moving. That is embolism. That's embolism. It could be air embolism. So causing occlusions, causing obstruction. Both will cause occlusion, but this is blood clot. This is moving blood clot. Moving blood clot or moving foreign material. Sometimes it happens. Foreign blood also gets inside, moves, causing obstruction. That is embolism. So I can do some research on these two words, thrombosis, embolism. And third one is hemorrhage. What is hemorrhage?
Uh, Blood came coming out of the breakage of artery or vein.
Yes, yes, bleeding. So these three are very close, causing brain stroke. Brain stroke can be caused by any one of these three reasons: thrombosis, embolism, or hemorrhage. Very important. Follow it. So can we go to chapter 17 further, or you have any questions from previous
Yes,
chapters? Or yes,
question number 6, like a left ankle ulcer from leg atherosclerosis.
no, left ankle ulcer from leg atherosclerosis. Now here
Yeah.
again we have to abstract. We have to list out the problems. What are the problems here?
Ulcer,
Ulcer
Ulcer
is
and
one problem.
that's, yeah,
Then
and atherosclerosis.
atherosclerosis.
yes, the patient has two problems. One is atherosclerosis. The second is ulcer. Atherosclerosis. So the thickening, the arterial wall is thickening. That is atherosclerosis, and because of that, the patient developed ulcer on the left ankle. Now we have to cover these two. If you have single code, that is well and good. Otherwise, you have to give multiple codes. That's the objective. So we should always look for combination codes. Now,
Sir,
for main, yes,
so these are like arthrosclerosis and arteriosclerosis, atherosclerosis. These are the synonyms.
yes, there are synonyms. That's the reason if you go to atherosclerosis, it will tell you to go to C arteriosclerosis.
So these
Uh,
three all are like synonyms, right? Okay.
Three, what are those three? Atherosclerosis,
Yeah.
arteriosclerosis. What else? These two.
Atherosclerosis, then arteriosclerosis, and then one term is also atherosclerosis. AN, no?
No, no, only these two: atherosclerosis,
Okay.
arteriosclerosis.
Okay. Atherosclerosis. Okay. Thank you.
So yes, what you do? Take the main term atherosclerosis, and under atherosclerosis, look for leg. Okay, that's fine. What happens in atherosclerosis? Wherever there is atherosclerosis within the arteries, blood flow,
Thick.
the blood flow will slow down. That is, so we are directly going to arteriosclerosis because if you go to atherosclerosis, it will tell you to go to arteriosclerosis, right? Now, arteriosclerosis in the leg, that's important. So here we have the leg. There's so many entries. Arteriosclerosis of this is hardest part of coding, arteriosclerosis of the peripheral arteries. So to just work with very closely, then otherwise you'll get confused because this
So can we learn how to read the index of this specific condition?
yeah,
Yesterday,
this is
yeah,
indentation, but you have to follow the
yeah,
indentation. But see, always the learning process, what happens, for example, there are 7 characters, the maximum is 7 characters, right? So the
yes.
accuracy is about 7 characters. If the code has 7 characters, accuracy is about 7 characters. If the code has 4 characters, accuracy is about 4 characters. Now imagine a code has 7 characters. What happens is, I mean, I'm not saying it is not possible, but the expectation is people will take some time to get to reach of get to the 7 character accuracy, especially in the index. Some terms they have very few entries under the main term, but some main terms like arteriosclerosis, you have almost 6 to 7 levels of entries, one by one. So it's hard, but all you have to do is read arteriosclerosis maybe 10 times, understand how it is organized. What is the first level of sub entries, second level, third level, fourth level, fifth level. Sometimes you find sixth level also. There's sixth level, and you have the seventh level. So that's the only way to get it. But the process is same. whether it is 2 levels or 3 levels, generals to particulars. This is like this. So, um, yeah, because again, why there are so many entries? Because classification. This is classification. Um, Leg. So we are talking about so right or leg in the question.
This is
Right,
left
left, right,
ankle,
left.
Yes.
left ankle ulcer from leg arthritis.
For example, this is leg. Under this left side,
Yes.
under the left, we have with ulceration, ulceration, under ulceration, which part of the leg? Is it ankle, cough, ankle, I-70 or 343? But you should be very careful. Is it is it right code or not? Because there are so many for the same right or left leg. We have so many entries. For example, here you'll find I-7339 left right. So I-7349, and somewhere else you'll find, for example, I-70.649. There are different codes depending upon the type of artery within the leg. So following this indentation is important. But at this point of time, yes, if you're able to reach up to this third, fourth level, yes, you're good. And you're able to identify what are the complications of atherosclerosis. What are the complications of atherosclerosis? Gangrene, rest pain, ulceration. Yes. So go through these um, arteriosclerosis main term a couple of times. So you'll see the difference between I-7.243, I-7.343, I-7.443. The codes are classified like that. For that, best way to is to go to tabular list, examine the codes. The difference between 143, 243, 343, 443. Yes. Any other questions?
Thank you.
Generally, even for example, any learning process, what happens? For example, yeah, I mean, I can give you any examples. The harder tasks. There are simpler tasks, harder tasks. Simpler tasks, you'll be able to achieve the required accuracy within short period. But for harder tasks, it takes some time. You have to listen, you have to read, you have to write these things. So yes, but as you gain experience, you will definitely get to this. What else?
So for this same example, can we please check tabular list and see the difference between
Yes,
243 and
absolutely.
343 or 443?
Yes.
Thank
So to
you.
understand this, it also requires the treatment that is given for this arteriosclerosis. Um, this is I-70, right?
I 70, 443, and 243.
So this is classification of diseases. Now we are here with I-17. Now I-70 is the category. Arteriosclerosis. Alternative terms, arteriosclerosis, arteriovascular degeneration, these are all synonyms. Now I-70, how it is classified, let us go from the beginning. I-70.0 0, 1, there are different arteries, but we are talking about extremities, legs, right? I-70.2, it starts from I-7.2. 2, um, unspecified atherosclerosis of native arteries, right leg, whereas 2, 1, what is the difference between 2, 0 and 2, 1? This is not telling whether right uh, atherosclerosis of native arteries of extremities with intermittent claudication. So in this case, the patient doesn't have any what you call manifestation, but here the patient has intermittent claudication. So we are focusing on,
So claudication means, sir?
yes, the patient has pain. Intermittent claudication is pain. So ulcer, we are looking at ulcer, right? 243. Atherosclerosis of native arteries of left leg with ulceration of ankle. Now, if you look at this 233, this is about right leg.
So
So
443.
443, right? Atherosclerosis of autologous vein bypass graft of left leg with ulceration of ankle. Very closer, but what is the difference between 243 and 443? And of course, in
This
between there is 343. Yeah.
question.
Bypass graft. Okay.
Yes. So what's happening? What is the treatment for this atherosclerosis? For example, imagine a patient has arteriosclerosis in his left leg. What is the treatment? Yeah, you would look at the treatment also. They try with medicines. If it is not resolved, they'll do the surgery. What is the surgery again? Bypass.
Bypass.
Similar to what they do in the coronary in the heart, they will do similar thing in the leg also. Now the surgery is done. Patient has bypass veins, grafts in the left leg. But after 2 years, again the patient developed arteriosclerosis in the grafted vessels also. That is what it is talking about. 2 to 3 native arteries. Native arteries means the patient's own veins, own arteries. That is native. The bypass was not done. That is 2 to 3. But 243 is uh, bypass. 343. So this is the difference you would understand. Native arteries and bypass arteries. The codes are different for native arteries, codes are different for bypass. So the tabular go through I-70, entire I-70 category. Look at this. So just I-71 category, we have page number 1, 2, 3, 4, 5, 6, 7, 8, 9, 9 pages here. Just one category. It is supposed to be not more than one page, but you have 9 pages. I-70. It's all talking about atherosclerosis, arteriosclerosis. So yeah, it requires, it's the hardest part of cardiology coding, but don't worry, you'll get it. So here the tip is looking at whether it is native arteries or bypass arteries, and what is the manifestation. The patient has ulcer or pain or other issues. So nothing is mentioned, so that means you have to take it as native arteries. That- So this question is only for you to understand, yes, there are going to be questions like this.
Yeah, there is one related over there, question number 14. It's
Yes,
unstable angina.
correct. That was correct. But this is related to heart,
Coronary.
not leg. This is leg, this is coronary. That's the difference. All right. So work with yes, for simple questions you'll get the answer instantly, but some harder. See, any exam works in the similar way, right? For example, the CPC 100 questions, 70% is a mock pass mark. 90% of the people they get the score between 70 to 80. If you look at the past candidates, 70 to 80. Why? Because 70 to 80% of the questions are at basic level, and another 15 to 20% will be at intermediate level, and the last 10 will be at advanced level. So what I'm trying to say, yes, if you're thorough with basic to intermediate level questions, yes, you're good. Because for example, if I bring another coder with 10 years of experience, ask him to write the exam, yes, the score will be around 90. It's hard to get 100%. So that's where the effort skill matters. All right. So focus on simple questions, and your objective is to get the accurate code for the simple questions and intermediate level questions, and the advanced level questions. That's okay if you're able to reach up to the third or fourth category.